Hi, I'm Barbara Powell, your Colonial Benefit Representative. And first off, I want to thank Mark Lebluski for allowing me to speak with you. The purpose of this video is informational. Your employer is offering you some exciting voluntary benefit options. And I should say that voluntary benefits are not health insurance. Health insurance helps you with the basic medical bills, minus the deductibles, co-insurance, and co-payments. And they pay the doctor directly, and they pay the hospital directly. Voluntary benefits pay you directly, and they pay in addition to whatever other benefits you have. Now, I know that some of you may be covered under a parent's insurance or a spouse's insurance, and some of you don't have any medical insurance at all. But the voluntary benefits will fill any gaps that any other insurance does not pay. So it'll help you to pay that deductible or that co-pay, and the advantage to you is that you get a check in the mail, and the real advantage is that you have peace of mind that you don't have to worry about paying that bill. If you haven't already done so, along with this video, I emailed a worksheet, and on the worksheet it has a list of the voluntary benefit options. So if you haven't done it, you want to stop the video now and go ahead and print this out, because on the left-hand side of the options are bullet points. So if there's anything that's of interest to you, you can mark that off, and then you can also write notes on the back so that when I meet with you for your individual session, we'll have talking points to talk about. Okay, so let's begin. The first benefit on here is disability insurance. What is disability insurance? That is income protection. Have you ever thought about what you would do if you were not able to come to work due to a serious accident or injury, or due to a sickness? How would you pay your bills? Well, disability insurance will be sending you a check directly that will help you to pay your rent, gas, mortgage, utilities, groceries, car insurance, all of those other bills. If you're currently living with your parents, you still have some responsibilities: car payments, car insurance, phone bill, credit cards. So this is a way for you to protect your income. When I meet with you, we'll go over different levels of coverage. These are very affordable benefits. They could range anywhere from $4 to $12 a week. So we're not talking a lot amount, but you will have peace of mind to know that you have taken care of your responsibilities and that you're not dependent on anyone else to do that for you. So if you have an interest in disability insurance, you want to mark off that bullet point right now. Okay, the next thing on here is accident insurance. Accident insurance is something that is applicable to almost anyone. These days, people are more active, regardless what your age is. In Florida in particular, there's people that do jet skiing and water skiing and rollerblading and boating, and there's potential for accidents. Just recently, I was talking with an individual who went paintball shooting, and he got hit near the eye and needed eye surgery. And you know who you are. But accidents happen, it's a reality. So this is something that will help you pay those out-of-pocket medical expenses. The accident insurance will walk you through all phases of an accident services you would get. It will pay you benefits for ambulance, emergency room, hospital admission, per day benefit amount, aftercare like wheelchair and crutches, catastrophic loss, and even an accidental death benefit. So if you have an interest in accident insurance, check that bullet mark off. The next thing on here is life insurance. Well, most people understand the need for life insurance. However, I am told that some young people feel they are impervious and they don't have that need just yet. But rather than waiting until you're older, you have an advantage as a young person to get a very, very low premium. And we have different choices to choose from. You have a term life and a universal life. Term life is just like the name says, it goes for a term of time, usually 10, 20, or 30 years. Whole life policy, premium is based on your age, but it does not go up over time. So you can lock in a low premium, and the advantage to you is that you can take this with you when you leave the job. So your cash value will accrue interest over the years, and your premium should be the same the day you got it. The reality of life insurance, another point to consider, is just looking at the news. If you, all the shootings that are going on with shootings at movie theaters, restaurants, schools, Not to mention accidents, car accidents, very common. So would highly recommend that you consider looking at the life insurance. So if you have an interest in that, check that bullet point off, and also share this information with your parents or spouse, because they are going to be the beneficiaries and they should be aware of what options are being made available to you, and you should be able to make a joint decision. Okay, now the next things on there are critical illnesses, things like cancer, heart attacks, strokes, organ transplants. Maybe that's not as much a concern for everybody, but I'll bet you everybody that is listening to this video probably knows somebody personally who was diagnosed with cancer, either someone in their family or someone they work with. It is very prevalent these days, and this plan will pay you benefits based on services rendered. And they pay in addition to whatever your medical pays. So it's going to help out with those out-of-pocket expenses and even some expenses that aren't covered. Things like travel expenses. This plan will pay benefits for travel and lodging. So your spouse can go with you if you have to travel to Houston, and we'll help out with that airfare and the lodging. It also has a wellness benefit. Every year, as long as you go in for a wellness test, we will pay you $100. Almost like return of premium, because you're going to go in for your wellness test anyway. No claim form is necessary. You just call us and we send you a check for $100. So that's part of the cancer policy. The critical illness policy is for those people who have a family history of heart problems. It covers 7 major catastrophic illnesses, which would be heart attack, stroke, bypass surgery, major organ transplants, coma, and I'm not really sure all the rest, but it pays a lump sum amount to you upon diagnosis, because what we find is that these are financially draining illnesses. They are ongoing. You have constantly taking off from work, going for treatments and whatnot. So this will give you the peace of mind that you know you have a check coming in to help you pay the bills. And the last thing on your list is hospital confinement insurance. Now this is designed to fill the gaps specifically of the deductibles and the co-insurance. So each time you have a hospital confinement, regardless whether it's an accident or a sickness, it will pay you a lump sum amount upon going into the hospital. Also has benefits for outpatient surgery and rehabilitation services. So if you have an interest in supplementing the medical insurance that you may currently be on, this would be something that you would consider. And so in conclusion, I want to say that you should have certain things marked off. Take the time to fill out the information at the bottom, your contact information, and you can email this back to me, or you can give it to Mark so that he can get it to me, and I will make arrangements to come out and meet with you in person to give you your benefit counseling session. Now I want you to know that you are not in any of these benefits. This is a benefit counseling session. Insurance is not something that everybody has a high amount of knowledge on. So this is to help you out to understand insurance benefits and to understand what your personal needs are. And then we'll make recommendations for you to get the benefits that are correct for you. In fact, we have a site that you can go to. This is something that you can go on benefitslearningcenter.com, benefits with an S, learningcenter.com, and it will ask you a series of simple questions that let you know where you are in your life and make benefit recommendations. And it's just more talking points that you could bring up when I meet with you in person. So I'm looking forward to meeting all of you. Make sure you fill this out and get it to Mark within the next few days, and then I will be getting back to you next week to set up individual sessions. Thank you for your time.